And there's a lot of medical professionals who are pivoting out of career fields that they love because they feel that seeing so much death and doom and gloom and stress that they're saying life is too short. I no longer want to be in the medical field. They feel as though they are not postured for success.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
This week on Power Supply, we speak with Tahjar Roamartinez, Chief Executive Officer at Cyber Warfighters Group Incorporated. This is the first of two episodes about cybersecurity and how this is emerging and the threats to supply chains specifically, but obviously healthcare institutions all across the country. So Tahjar is the CEO, president, and founder of Cyber Warfighters Group, a global cybersecurity consultancy, and she leads multi-billion-dollar projects that ensure the sustained stability, security, and success of both the United States government and F-100 clients. So she has a very broad understanding of cybersecurity, not just in healthcare, but really in all walks of life. She earned her MBA from Texas A&M University in Central Texas, as well as her BS in Computer Information Systems. So she certainly is the right person to begin this conversation around cybersecurity. So stay tuned. We're going to be right back in just a few minutes with Tahjar Roamartinez.
I'm Hays Waldrop.
This is Garry Skinner.
And I'm Justin Poulin.
A production of 17 Studios. You're listening to Power Supply.
Joining us now is Tahjar Roamartinez, Chief Executive Officer at Cyber Warfighters Group Incorporated. And by the way, Tahjar, I love the name of your company, and I'm so excited that you're joining us today to talk about emerging cyber threats, and specifically as it relates to our supply chain audience. So welcome to the show.
Thank you. Thank you so much. I am honored to connect and share my passion, and let's have some fun and educate along the way. So I'm super excited. Let's get after it.
Let's roll.
Game on.
You absolutely hit our key points, education and passion. And so I want you to talk to us about your background, but really more like, how did you develop a passion for cybersecurity? And, sometimes I think people think, the IT guys are kind of dry, or the IT ladies are kind of dry. And,
Not so hard.
I can tell that that's not the case here. And I've seen that change over the years. I think that's an old stereotype that doesn't exist anymore. So tell me how you found your passion and why it is different in today's environment as it relates to people helping in the IT world.
Well, thank you so much. And thank you for your audience and this great podcast. So little did I know, hindsight 2020, I was born into cybersecurity, starting with layer one, physical security. So I am first generation Afro-Cuban, born in Brooklyn, New York. And so to kind of bring clarity to what that looks like. So when I talk about physical security, I woke up every morning, I looked in the mirror, and I tucked a razor blade between my cheek and gum with the sharp side up. And then I walked through pimp, drug-infested neighborhoods. I took a 1-hour train ride one way to get to a school that specialized in STEM, which is for science, technology. We all know engineering, mathematics. And that was the only way to get out of my circumstance. That was dark. And, there were what you call cyber criminals in the cloud. Those cyber criminals was at every corner, every street. And so being able to navigate that and being vigilant, being born with that level and cultivating that level of vigilance, it built me for where I am now, from saving the nation at the highest level globally and being vigilant, starting with, of course, like I said, physical security, all the way to leveraging technologies at the most senior layer. And so that's where my passion started. It was grown serving our country. I'm a retired Army officer and I serve at the highest level when it comes to cybersecurity. I still in that space with the clearance and sharing my passion with communities of folks who look like me and saying cyber IT is cool. It's swag and it gives you a great lifestyle. So that's how I started.
Great story.
Tahjar, I wish everybody to our listeners right now could see you. You have such swag. I love what you're wearing right here, number one. But you mentioned briefly about growing up in New York. Tell us a little bit about your family. What did that look like? And also, I should say, thank you for your service. We appreciate that.
Absolutely.
Oh, well, thank you so much. I'm first generation American Afro-Cuban. The correct pronunciation of my name is Tahjar Roamartinez. And I grew up the only girl. There's 10 males in my home. And I was the youngest and the smallest and probably the most feisty. And
toughest for sure.
The males, the boys had a reputation. So I had to counter that going behind them in school. And no, I actually have brains and I'm not athletic like that. And so it was just amazing. Couldn't get a date because when you're in a house with the most feared boys in Brooklyn, you don't get dates. And so now we're going to turn into Dr. Phil. I need Oprah now, but that's kind of.
That had to give you a lot of a sense of security and independence too, being the only girl, right?
It did. It did. I mean, simple things of using craft to not get the ends of the bread. It was this thing. To this day, I will not eat the ends of a loaf of bread, and really being really humble. And that's another reason why I wear a fedora. It's to my humble Cuban roots. So whether I'm with kids in the community or I'm on the Hill at the Capitol, helping small business and then behind the scenes fighting for veterans, the fedora is just a humble reminder of my humble beginnings to keep me hungry and keep me humble. And so that's the story behind the fedora.
Love it. Love it.
Love your story, Tahjar. Love your story. And you know what? Thanks again for being on our podcast today. And as we dive into this, it seems like we could have, part 1, part 2, part 10 on cybersecurity. Every time we turn around, we see something in the media. We see something, somebody's hacked into something, and it's not simple. It's not simple. And you have that SME subject matter expert topic that you can share with us, and maybe just a broad base to start with to kind of tell us what you're seeing. We dive a lot into hospital supply chain and all across the board, across the country. And as you dive into this, what are you seeing? What's the base? Is it increasing? Is it at the forefront? Just a broad base of what you're seeing right now would be helpful.
Well, I don't want to fearmonger everyone, but this is the perfect storm of the worst of the worst. So at a very, very high level, and yes, we can have a 10-part series on this, but here's one thing no one is really talking about. So everyone knows about the threat with the supply chain and the medical devices and what we call Internet of Things as we're getting more innovative, helping folks monitor their diabetes with devices. That's what we call Internet of Things. As the more of those devices are added to the network, that adds another 7 to 10 points of opportunities, or how you would say low barriers of entry. And the reason that is a lot of vendors, especially in the health sector, unlike any other sectors that we work in, whether it's energy or finance, I am taken back that the health has the least strict mandates or requirements, not only with securing the infrastructure, but holding their vendors accountable, the ones who are creating these devices that are supposed to improve and extend the quality of our lives. But one new uptick that folks are not talking about, as COVID is coming and folks are losing jobs in hospitality, our company provides a training in IT. And there's a lot of medical professionals who are pivoting out of career fields that they love because they feel that seeing so much death and doom and gloom and stress that they're saying life is too short. I no longer want to be in the medical field. They feel as though they are not postured for success, and they feel like it's a no-winning battle. And so what is stirring up is you have an internal threat that no one's speaking to. Now you have very egregious and angry internal healthcare professionals who are taking care of your loved ones. And they are now an insider threat, either intentionally motivated or by distress, monetarily motivated, because right now in the health sector, it is so financially lucrative to be on the dark side and be on the benefit side of these cyber attacks and these ransomwares.
Yeah, I can tell you there's a lot of retirement going on, and a lot of it's nurses, to your point, but there's a staffing shortage that's emerging for sure. And it's going to make it hard because the population that needs that care, that's aging in that boomer generation, there's going to be less people to take care of them as they grow in size. And many of them, that's the largest generation this country's seen, are entering retirement, and they were hanging on there to keep things going. And then because of COVID, you're right, many of them said, you know what, I've got enough money to retire. I'm going to retire. But what that also does is it creates an opportunity. And I know there's the ransomware and there's some of the concerns over there, but it also creates an opportunity for technology to help allow us to keep up with a decreasing workforce to replace those jobs. Like, it's got to come from somewhere, and it isn't going to come from human bodies. It's going to come from artificial intelligence or augmented reality. It's going to come from, technologies that help us, be more productive and be able to get more done with less human resources. But does that not also just escalate the risks that we have as it relates to cybersecurity?
Absolutely. And to your point, we need to automate. When you talk about artificial intelligence or you hear the word AI, where you reduce human error or human factor is to automate some of those processes that can be repeated to combat that. You also have opportunities in those who are in environment control systems or HVACs that you see. The last big attack, I believe it was through Target, leveraged HVAC systems. And it's in every hospital. It's mandatory. And so the same way there are downsides, there are upsides to opportunities to get into a new career field, especially if you are mid-level in your career. Automation is one of the factors, but there is definitely a series or a defense in depth. So it's not just people. It's not just technology. There are firewalls, for example. So remember, I mentioned the devices, for example, the diabetic devices. You have respirators, defibrillators. All of those are called IoTs. Well, how do we secure those things? And that can be done clearly by firewalls, endpoint solutions that secure those devices and protect our quality of life. Here's what I did learn just recently. What can be done? And some of them, I'm still a certified ethical hacker, so I'm gonna be careful and very conscious of what I share because there are everyone listening, good and bad. So I'm definitely gonna be mindful of what I share as a vulnerability out there.
Don't give Garry any ideas.
Yeah. And it's not helpful that you also have ransomware as a service. So even if you are a high school kid during COVID and just busy, there are ransomware as a service on the dark side who will share all these vulnerabilities that are out there. And for a fee, you get to leverage that and exploit it for your own gain. And these are led by international and national cyber gangs that are out there. And so what can we do? Of course, I'm going to end it on a positive note. There are some 4 critical things that we can do, and I'll share that as we go along later in this podcast, but it's not hopeless. We just need to be intentional. And it's an opportunity for us to say, hey, how can we use platforms like this, get the information out, share? And I think that's where it all starts, because together we can do more.
Tahjar, you brought up some really patient-focused items. You talked about the diabetes monitors. You talked about defibrillators. You talk about all these bits and pieces of Internet of Things is what I've learned from you and have taken away. how much is the patient being involved in these dialogues? How much is cyber attacks reaching out to the patients to let them know that there's risk? I mean, that's really the end user you're talking about in supply chain and cyber attacks. Not only is it the care within the hospital, within that entity, but, we see direct manufacturer medical device to patients. How much is cyber attack awareness? Like, you need to be sensitive to your pacemaker that's attached to a device. What's that look like? How are we getting that message out to patients? Is that a focus? Is that ongoing?
Unfortunately, the culture, it's not. I mean, prior to COVID, I was in the nursing home as far as supporting and helping in my own way to give back. And the older generation maybe have an iPhone because it was a gift from a grandchild or something like that, to have communications, especially during COVID, because it's not that interaction. And simple things, and knowing that the new vulnerabilities of having certain Apple devices within certain parameters of a pacemaker, they don't know. How do we get that education out there? I think the way to do it is through not only community engagement, through churches, through local schools. That's how we can start reaching out to the community, because the elderly is not in the workforce. So they're not hearing it from their colleagues, or they may be retired and sometimes forgotten. But leveraging programs, the lodges, the local lodges who engage with our community, the courthouse, where folks are getting their services for their daily needs, and even social services, social security, so on and so forth, and partnering with those leaders to say, can I come in and just share or talk, or may I provide this information on your website? And so that's where it starts. It's definitely partnership.
I have a question. So we've talked a little bit about the end user in this case, and then we talked a little bit about ransomware. I'm certainly familiar with that concept. I know some guys have, been hit, but what's in between that? In other words, if I'm a hospital out in Topeka, Kansas, if it's not, maybe it's not ransomware and holding us hostage, but what else can those cyber terrorists do, and what kind of problems can they create?
Well, the one thing I will let folks know, and this is as of less than about a month ago, there is about 76% increase in the failed healthcare systems when it comes to securing the supply chain. And what does that mean? People throw that word out there. Well, forget about a ransomware, someone being very deliberate trying to come into your environment. There are situations and environments that are just waiting. It's like leaving the door unlocked. So, for example, we all talk about update your systems and update and provide updates to your devices. And when they say devices, firmware, but understanding training, it doesn't cost a lot. There are a lot of free resources out there for cybersecurity training. If you Google securing the human, there is free training and videos out there to train your staff to be more aware of what to do. The second thing is you have a lot of your vendors, they may be creating some backups. But what you don't know, it's equally important to update those backups that are still online and a back door to cyber criminals. And so being able to always stay top of mind and think like the criminals, we have great folks on our team, but I stay abreast technically because I do get out to speak on podcasts and folks like that and got to stay on top of the mind. How do they think? How do these cyber criminals think? In the health environment, you have a lot of legacy systems. What that means, outdated old systems that updates are not available or it's not being done. Training and teaching your staff, your healthcare intake folks, the basics of being vigilant with cybersecurity is a no-brainer. Won't tell you the city, but state of Texas. Right before COVID, I walk into a nursing home. The code to get into the nursing home is take to the window.
1, 2, 3, 4.
No, it wasn't one, but it was take to the window. And I got to go through my phone, but I believe I have pictures because I was like, no one's going to believe this. And so I took the code and I walked in, and there were personal private documents sitting on the counter. This is a nursing home. And so, simple things like that. It doesn't require any money. It just requires a little bit more awareness to secure your loved ones, your elderly, That same level of vigilance should be as though I'm entering a nursing unit in a hospital. You have to have the badge match the mom and the baby and so on and so forth when you go there. And so that's just one of the ways within our healthcare infrastructure, from nursing homes to acute care, where the level of vigilance is not across the board. The culture is just not there.
So you said that you were an ethical hacker, I think was the term you just used. And I don't know
I am a certified
the exact
ethical
one.
hacker.
Certified. That's what it was. Certified. So I think that's really interesting. And I know you can't say too much for the obvious reason, right? But I'm assuming that role means that you're essentially testing the weaknesses because you know what the unethical hackers or the bad guys or the bad girls are doing. And so you're essentially testing the system. And so I want to kind of know, like, you're very good at identifying where those are and how to prevent them or protect against them and advise, companies. But once you're in, right, the unethical hacker, once they're in and it starts wreaking havoc, right, all of a sudden everybody gets the email with the conspicuous link, or, I remember a time hearing about one where it wasn't even, through the internet initially. It was a service tech who came to do copiers and plugged in a USB device that had software updates that was infected with a virus. And then it got into the internet and spread through the health system from there. But once it's in, no matter what the portal entry is, and, I love comparing that, being a nurse in myself and in background, you hear, what's the portal of entry? That's for every bacteria or virus, any infection. They all have a portal of entry, which is why I do like that virus, like people call them viruses, because it's the same thing. How does it get into the system? Once it's in there, it's wreaking havoc on the body, right? Or the organization. How can supply chain leaders really mitigate the impact once the hack is in there? Because as you mentioned, a lot of times they're being held for ransom. So anything we can do to quarantine that situation and really minimize the damage, what does that look like? Like, how can people be very mindful of that in the moment?
Well, I'll throw two words out there: least privilege. And so what that means that I may be the intake person and I take intake forms. My permissions or access to the network should be the very minimum that I need to perform my job, so that if someone's computer is compromised or their credentials, that means their logon, their identity to authenticate or be able to get access to the system, if that's limited and the entry came into my computer with my credentials, it stops right there. So the least privilege for not only the persona, the individual, but the least privilege for my system. So my system should be, another word I'm going to say, remember, it's 2 words. So it's least privilege and then segmentation. So what that needs to happen is, if I'm an admin, there should be a wall that blocks me from anyone who's not admin. And if I am in records, there is a wall or a domain, a barrier that says only the data in this area stays in this area. It's sectioned off. It's like, I have to talk football. I'm in Texas. No matter how hard I try to hang out around the VIP area there, I try to start conversations, but at the end of the day, when the game starts, they go, "Man, may I see your VIP badge?" And then I got to go down with the mere mortals and have my favorite beverage. So there has to be a shutoff, a door that says, "Do not enter. You don't belong here," so that one point of entry doesn't take over the whole infrastructure. That's one of the ways.
So real quick, I think the most important follow-up question here is, what is your favorite beverage?
Well, everyone knows it's scotch. Come on. In fact, there's a rumor out there, and I was chilling with Army's Futures. I'm right here in Austin, and there's either a fallacy or an urban legend that if Tahjar shows up, somebody better have scotch, and at minimum 12 year, and it should be a Macallan. But if it doesn't, okay, right? Someone messed up and bought bourbon, but then they fixed it. So I am known. Someone has, and last night we were on, well, not last, the night before last, we were on the rooftop, and it's like 110 in the shade in Texas. I'll send you a picture, Garry, so you know what I'm talking about. I'll send you a picture. We're sweating bullets, and I'm sweating more than others because I have my scotch. And I did the right thing. It wasn't neat because it was 102 maybe at 6 o'clock in the evening.
Wow.
So my linen jackets are sticking to me, and so scotch is my favorite beverage. Neat.
Our producer just said Texas don't play.
No, nice. You're on such game point, Tahjar. Game on. 12-year McAllen's coming your way. When I get to see you, I know. Done.
What about us?
It's a known thing.
You're probably a bourbon guy,
Yeah,
Hays. You're from Tennessee. You're a bourbon guy.
I was just going to say, no, Tennessee whiskey, you can just send it to me, Hays. That's what about us? That's the answer.
That's right. Oh, my gosh.
No, I'm a whiskey guy. You all could send Hays bourbon and terrorize him a little bit.
I love it. I love it.
All right, last question, Tahjar, which is, you had alluded to this earlier in the interview about educating teams about cybersecurity. So what should supply chain leaders be doing to educate their teams? Because I like what you said is really preventive by, kind of quarantining and segmenting access. So that is a preventive measure that, IT teams can do as part of their cybersecurity protocols throughout the system. But, for supply chain leaders, even as they're working with their contracts analysts, what should they be looking for in contracting? How do they educate their team about this? And because it's always changing.
I just want to add to that Justin's point, Tahjar, before you go. I think about that in contracting. You made a really, really relevant point of, I think about all these clinical engineering contracts that have software upgrades. Tahjar brought that up earlier. So I'm really curious to see what your feedback is on this, Tahjar. Go ahead, please.
Yes, I have a customer right now outside of the health industry, but in banking, and we're doing just that. We're doing a third-party risk management program for them. And that's where I'm just taking a book out of the DoD where I was. And now they have a certified, it's called a CMMC, and it's a Cybersecurity Maturity Model Certification. And what it says is that vendors need to have all of these compliances in place to even qualify. And the DoD finally, after we've been saying this over and over again, they've now taken a stand. It's going to be a cutoff. They will start implementing in about 18 months, but in 36 months, if you are not CMM certified, you will not be in a defense space. You will not be a vendor in a defense space at all, or their partners. So it goes all the way down to the tier 2, 3, and all of those suppliers underneath there. So that's how you start to vet your vendors. Number 2, I'm going to go back to what could senior or middle managers do and how they should partner with HR and policy and governance. So that's another subject. But back to the vendors, holding them accountable and working real close with either your attorneys or your procurement officers who do those SLAs, those service level agreements, those MSAs, those master service agreements. Because what I've learned, as they say in Georgia, bless your heart, attorneys are so heavenly bound, they're no earthly good. So they say language that no one understands. And the contractors or the vendors are not, they're not held to the technical requirements. It'll say overarching compliance, but what does that mean? It doesn't say every week, I want to see your security health plan. Every month, week is great. Month is okay. Quarterly, at least you've checked the block. I've had a customer who had their vendors reporting to them annually. That is so unacceptable. And we're fixing that. So there should be some level of reporting on a weekly, and even that's not enough, but it's realistic to keep people daily monitoring. But what you can do is set up automated systems so you are talking real time to stay ahead of it, because the criminals are real time. They're real time on top of every opportunity that's out there. The way middle managers can help drive the culture and training, working close with HR, making it mandatory that every month there is cybersecurity training, not just during Cyber Awareness Month in October. Making it mandatory for employees working with HR and then working with legal or their general counsel to get this and policy. The central point of failure or success is at senior management. Because if they don't educate, equip, and empower their folks through budget and resources to make cybersecurity a priority, it just won't happen. So that's my 2 cents.
I think that's so important right now, too, because finances are really constrained in the hospitals today. They've been getting hit hard enough by one virus as it is. And so that's a really, really good point, Tahjar. We got to make sure that the budget dollars are there and, that they're allotted to continuing to defend the institution or the health system, into the future. You did a really, really nice job. And I want to tee up a little bit of a promo for you as we're wrapping up, which is to say you have a book on the way. And, I want to congratulate you on that because I know, I don't know from personal experience, and that's why I know it's hard to do. And so I know that is an enormous undertaking, and I really want to commend you for doing that. Can you tease the audience? I know it's not out yet, but can you tease the audience about the book and what inspired you to put that together?
So the book is it's 2 parts, twofold. It's therapy for me, and hopefully it will inspire someone that they can conquer anything with, first of all, perseverance. I believe with faith, hope, and action. If you have those 3 pillars in your life, faith, hope, and action, you will have the courage to start something, and you will have the consistencies and intentionality to finish. And so in 2019, I didn't take the opportunity, but I will moving forward. I was invited to Basel. And so at first I didn't even say it right. I said Basil. I didn't know. And I was invited to Basel. And so my new t-shirt will be from Brooklyn to Basel, baby. I mean, that is truly a snapshot of America's dream.
That's awesome.
Absolutely.
But that's not the title of the book.
So when's it coming out?
Well, I have the people who are going to publish it are giving me a hard date of spring 2022. I would like to have the approved draft by late fall, early winter. So that's what the goal is. But as far as if anyone knows in this world, you kind of don't control your title. I mean, if you want to be successful, you don't control the title of your book. But if you have other folks who are believing and investing in your project, then you may control the creative side, but they do that PR side, and that title won't work this well. So you kind of let the experts do what they do in marketing.
Well, Tahjar, you've done a great job of marketing yourself and your experience on this interview today. And I think you really inspired some people to be thinking about how to protect their organizations and themselves. Honestly, you did a nice job of expanding that out into some real life day-to-day, even at home stuff, or, for people who have loved ones that are in a vulnerable population right now too, and how to protect themselves. So great message. Wish you continued success. And I want to let you know, we really appreciated your time today, and great job with the interview.
Thank you so much for the introduction. And Garry, I will follow up with you as well.
Not until after he sends you his scotch. That was Tahjar Roamartinez, Chief Executive Officer at Cyber Warfighters Group Incorporated. And I have never met an ethical hacker before, but it just makes so much sense. I mean, things are changing so quickly with technology, and I know that's almost like a cliche these days. We all hear that, we talk about it, we live it. But honestly, cybersecurity threats are such an increasing point of focus in healthcare facilities all across the country these days that you really do need to be able to stay battle tested, stay caught up. And not only is cybersecurity such a threat, this is the first of 2 interviews that we're going to be doing on the topic. And I think Tahjar brought a lot of really important pieces of information to the puzzle, how we can all be prepared, what we can do to help prevent these types of attacks. And I just enjoyed her general energy today. But that's going to do it for this week's show. As a reminder, you can help support Power Supply by subscribing on Apple, Amazon, or Google Podcasts. You can also find us on Stitcher, iHeartRadio, Spotify, or simply search for Power Supply Podcast on your favorite podcast application. You can also access bonus content for certain episodes by downloading our smartphone app for iPhone and Android. We'd certainly appreciate a rating and a review because your feedback is important to the show. And on behalf of Hays and Garry and myself, thank you for listening to this week's episode of Power Supply.